I'm bringing management of the NHS back into democratic control by abolishing the arm's-length body NHS England. That will put the NHS back at the heart of government where it belongs, freeing it to focus on patients, less bureaucracy, with more money for nurses, an NHS refocused on cutting waiting times at your hospital.
Yeah, this feels a bit fishy, to be honest. It seems a little bit more like further centralisation and the funding being directly under the control of the government and their authority. He's saying it's making it less bureaucracy, but he's putting it under the direct control of the state. And that basically leads to situations where the politicians start to dictate healthcare and the needs of the sick people within England and Wales and Scotland. This basically rings to me as like a politicised NHS where the politicians, based on an agenda and state control, can direct the services of the NHS in any way which way it wants and finance the things that it feels is politically good rather than actually based on the data of the needs of real patients in this country. And it puts us at risk of becoming surveilled through our healthcare needs. It gives the state direct access to our data, and it can basically use medical records of patients and their medical histories to define and shape policy, and tracking our behaviours, tracking our movements, tracking our illnesses, and putting in mandates and limiting access to basic healthcare for political reasons. And it just seems a little bit manipulative in language ultimately, because it could just become a tool for state control and social manufacturing, and access to these things and the funding that the government have will just depend on the political decisions at the time. And healthcare access could be linked to our social behaviours and compliance as well. And, you know, it could lead to further censorship. And basically, if the government is in full control of your healthcare, that could basically self-silence doctors for speaking out what they feel is important and the needs of the patients, because they're going to be employed by the government. And if they descend and talk up against something, then it sort of restricts that ability for doctors to do so and have real autonomy in making decisions that's best for the patients rather than what is politically correct at the time. So I don't think it's a good idea putting the NHS in full control of the government, and over time they can just decide which services are essential and which aren't. It just creates this sort of like top-down mandate ultimately. So yeah, they're my initial thoughts, but what do you think? Stay curious.